Dear student, I am Dr. Prakash Mungli, Professor of Biochemistry. So in this lecture, I will be going over briefly on sulfhemoglobin, cyanmethemoglobin and glycated hemoglobin. Let's get into the details. Sulfhemoglobin and sulfhemoglobinemia. It is sulfhemoglobin, it is the covalent and irreversible attachment of sulfur to porphyrin ring. And because of the attachment of sulfur to the porphyrin ring, so which leads to a sulfhemoglobin, and that leads to greenish coloration of the hemoglobin molecule. And sulfhemoglobin cannot bind with oxygen. And the cause for sulfhemoglobinemia is usually a drug induced, and some of the drugs that leads to increase in sulfhemoglobin is a dapsone, sulfonamides, sulfasalazine, phenacetin, acetanilide and sulfonamides. These are most of them are sulfonamide group of drugs, so which will lead to sulfhemoglobinemia. Bluish or greenish coloration of the blood is the characteristic feature of sulfhemoglobinemia, and also skin and mucous membranes will show cyanosis because oxygenation process is not going on with the sulfhemoglobin. And 0.5 grams percentage of sulfhemoglobin may lead to cyanosis, so even a very small amount of it can lead to cyanosis here. Though it is a self-resolving condition, but blood transfusion can be necessary in extreme cases of sulfhemoglobinemia. Coming to cyanmethemoglobin. Cyanmethemoglobin is whenever a methemoglobin is reacting with the cyanide, it forms a cyanmethemoglobin. Usually in cyanide toxicity, amyl nitrite is given as an antidote, and what this amyl nitrate does is, amyl nitrate, it is going to oxidize the ferrous iron in the heme of hemoglobin into ferric iron, thereby converting hemoglobin into methemoglobin. Because amyl nitrite, as you know from methemoglobin lecture, that nitrite, nitrate, nitric oxide, benzocaine, lidocaine, prilocaine, all these oxidizing molecules, they will increase conversion of ferrous iron into ferric iron in the heme of hemoglobin, converting them into methemoglobin. So overall, by giving amyl nitrite, there is increase in the methemoglobin, and why that is done in cyanide poisoning is methemoglobin has got higher affinity for cyanide, so methemoglobin will go and bind with the cyanide, thereby it becomes cyanmethemoglobin and it will be degraded and excreted out of the body. So here cyanmethemoglobin, it is going to trap cyanide and do not allow that cyanide to go and bind with fourth complex in the electron transport chain, that is cytochrome A3 complex. So overall, it is going to prevent cyanide inhibiting electron transport chain, and that's how cyanmethemoglobin comes in. Coming to glycated hemoglobin. Glycation of hemoglobin is a non-enzymatic process. Basically, whenever there is a higher glucose levels in the blood, and some of this glucose non-enzymatically will bind to amino group of N-terminal valines that are present in beta globin chains of hemoglobin molecules, especially in the adult hemoglobin. And the amount of this non-enzymatic glycation is proportionate to the blood glucose concentration. And most commonly used glycated hemoglobin in practice for the diagnosis and monitoring of type 2 diabetes mellitus, and also in type 1 diabetes mellitus, it is HbA1c. And note that normal percentage of glycated hemoglobin, that is HbA1c, is 4 to 6% of total hemoglobin, and it measures blood glucose levels for an average of 16 weeks duration. That means if HbA1c is determined, it will give an average value of blood glucose, which is for 16 weeks duration, because since hemoglobin is present in the red blood cell and red blood cell lives for 120 days, so the changes in the blood glucose levels are monitored for 120 days, because continuously this glucose will undergo non-enzymatic glycosylation process with the hemoglobin molecule. So, glycated hemoglobin, that is HbA1c, it is used in the diagnosis and monitoring of diabetes mellitus. So, this is in brief about sulfhemoglobin, Cyanmethemoglobin and glycated hemoglobin. Thank you.